Well, good morning, good afternoon, good evening, depending on when you're listening to this. But welcome to the MBLEx review course. My name is Jodi Scholes. I am your instructor for the course, and I'm so happy that you're here today. Today, we're going to be talking about medications. I've gone a little off. I was telling the graduates earlier, I've gone a little rogue. We don't normally uh, do a class specifically on medications, but so many of you grads have asked me about what medications do you need to learn. And therefore, today's class is about medications. We're going to be covering the most popular, seven popular medications here in the United States and what you'll need to know. But this class, as you know, is done in three parts. So the first part is a test-taking strategy. This allows you to approach the MBLEx with more tools in your toolbox than just your learning. We're going to talk about test-taking strategies. Then we move into our learning, and our learning today is on medications. And then in the third part of class, we're going to dissect some questions. And that will allow you to practice dissecting questions, practice understanding what those questions are asking. And so let's get right into part one of class, and that is doing meaningful homework. So each week, I give you a strategy about the test, and sometimes that strategy is about what is the MBLEx as a computer adaptive test. Sometimes it's about dissecting questions. How do we dissect questions? What does that even mean? Uh, Sometimes it's about game day prep, how you're going to prepare for your test. But today, I want to talk to you about doing meaningful homework, because there is a universe of information that you can try and study, try and memorize, right? And oftentimes there's piles of books and there's notes and there's, writing, and there's, my books from school, and, oh, let me watch some lectures. In fact, many of you have ended up in this classroom because of the YouTube lectures, the YouTube classes. And so in this class, we do meaningful homework. And what that means is we follow the guidelines for the Federation of State Massage Therapy Board's recommendations. And I'm not sure your instructors shared with you, but there is a sheet of what is on the MBLEx. In fact, I wasn't preparing to show this to you, but I will go ahead and call this up. Let's see, FSMTB. In fact, let's make sure you're seeing the proper screen. Take a look at this. This is the federations. You've been to this website. If you have taken the MBLEx, you've been to this website. But did you know that under the MBLEx, it has this little button, exam content? Look at the URL, exam content. Yes. And so here we scroll down, and there is a live link to the exam content. And if you're a patron, I'm going to go ahead and attach this to our lecture today so that you can see it again. But this tells you what is on the test. Very specifically, and it tells you how much of a percentage. And so allow this document to guide meaningful homework. I recommend that you take one topic each week. There are 8 topics. 1, 2, 3, 4, 5, 6, 7. Yeah, 8 topics. Let's double check that. 1, 2, 3, 4, 5, 6. I think there's only 7 topics. 1, 2, 3, 4, 5, 6, 7 topics. My apologies. I break them in. I have 8 categories, but there are only 7 topics. So every 7 weeks, you can move through this material. Every 7 weeks, you can move through this material, focusing each week on one category. That's an example of doing meaningful homework. You have a guide. And look at, say, week 1. You go through the system structures of each of the different systems of the body. Then you figure out what do those systems do. There you go. There's your anatomy and physiology. Week 2, you'll see there's 12 questions on kinesiology. And here's some examples. Now, if for some reason this document is overwhelming to you, and it is to many, then that's why you're here. Each week, we move through one of these categories. Today, we're digging down on client assessment, reassessment, and treatment planning by talking about medications. But that's an example of doing meaningful homework. You set aside the time. When you actually go and you do your homework and you set aside time to study and you shut the door and you study, let's make sure it's not taking you half an hour to get organized, right? Sometimes that's me. I sit down to do a project and it takes me 20 minutes to get organized. Okay, where's this? Where's that? Where's this? And so this will allow you to structure your study sessions, know what you're studying that week, and therefore be doing meaningful homework. All right, that's the idea. That's the idea of doing meaningful homework. Okay, you ready to move into some learning? Yes. Let's take a look at what we've got for today. Okie dokie. All right, a nice clean copy. Welcome back. Or welcome if you're here seeing this for the first time. I am super glad you're here. We've just had a couple more people pass the MBLEx this week. Yes, Jennifer, yesterday, brand new, yesterday, passed the MBLEx, yay. Haven't even gotten her announcement up yet. And so that is your finish line, right? That's why you are here. This might be your starting line, and it is your starting line for today. But your finish line is passing that MBLEx. And you are in a community of massage school graduates who are serious about passing the MBLEx. So what will we need to know? Part of what we're going to need to know is medications. Let's get to it. Here are the medications we'll be covering today. These are some of the most common medications prescribed in the United States. There are lots of other medications. You could expand this list. But let me assure you, there's only going to be between 3 to 5 questions on your MBLEx to do with medications. If you see 5 questions, that means you've gotten a lot right. Celebrate! If you're getting harder questions, that means you've gotten those answers correctly. You've answered those questions correctly. Lisinopril, let's get in there. Lisinopril, excuse me, I put the pronunciation so that we actually say it properly. Lisinopril. Lisinopril is very simply, it's to treat high blood pressure. Now, there's a lot of other conditions that it does treat. We'll cover those in just a moment. But this medication, Lisinopril, that is the generic name of this drug, and it's a medication that is an ACE inhibitor. The Centers for Disease Control tells us that almost half of Americans are living with high blood pressure. So 1 out of 2 people. Many of those are taking medication to control their hypertension or their high blood pressure. Hypertension and high blood pressure mean the same thing. Lisinopril, again, is the generic name. Let's move on. Prinivil and Zestril, all those trill words, trill words, those are the brand names. So companies that make Lisinopril name it, and that has a brand name. We are normally tested on the generic name. Okay, so how does Lisinopril work? It works by relaxing the blood vessels. By relaxing the blood vessels, it prevents the narrowing of those blood vessels. So with hypertension, sometimes there's cholesterol that builds up in the blood vessels, and it makes them narrow. Medications like this, an ACE inhibitor, relaxes the blood vessels and allows for more space. In those blood vessels. So as a result, it prevents backups. It prevents blockages. So Lisinopril is generic and it's inexpensive. It's been being prescribed for over 20 years. And as I showed you, this is the Zestril is the brand name, one of the brand names. ACE inhibitors are also prescribed for other reasons, not just hypertension and high blood pressure, but for you and me, hypertension, high blood pressure. Here are some of the other reasons that it is prescribed. Now and then, if someone's had heart failure, then they'll be prescribed an ACE inhibitor like Lisinopril. Sometimes heart attack, other things like that. But really, for the purposes of the MBLEx, what you'll want to know is ACE inhibitors relax blood vessels, and the most common is Lisinopril. You have not lost your connection. I'm still here, just making sure that we get a clear copy. Okay. Oh, this is the slide in the wrong order, but we will take a look at this. In fact, this is supposed to be some of the side effects of Lisinopril, but we're looking at Lipitor. So let's just mention that the side effects of Lipitor are headaches, sometimes low back pain. So this is Lipitor. Well, I'll come back to this in just when we're talking about Lipitor. But I see I've made a mistake with where this slide got entered. It's a new slide. Some of the other side effects of Lipitor: diarrhea, stomach upset, muscle and joint pain. But let's move along. So back to ACE inhibitors. Wanted to show you something here about ACE inhibitors. Our ACE inhibitor is Lisinopril. But look at all the ACE inhibitors. They're all pril, right? Pril. Now, the brand name may not be, but our ACE inhibitors are all pril. We're normally tested on the generic name. The way that I remember this now is I think of pril and I think of Phil. Famous pril, Phil. So pril trill, that's another, if you see there's a few trills in there. There's one trill, I think. Anyhow, but famous Phils, famous prills. Who is a famous Phil that you'll remember? The first Phil that popped into my mind was Phil Collins. Maybe you love Groundhog's Day and Puxatawny Phil. That's the other picture there, the groundhog. The groundhog, Puxatawny Phil. So Prill, Phil, and think of them holding an ace, the card, the ace. I need to have visual ways to remember these things versus just memorization. I need a visual. And so a famous Phil holding an ace. You can have an ace of hearts, you can have an ace of clubs, whatever ace you want. But famous Phil, famous Prill, is holding an ace. Why is he holding an ace? Because it's an ACE inhibitor. And then you'll know it's meant to treat muscle hypertension or high blood pressure. Okay, Moving along, we have Synthroid. I don't know how to pronounce those first names, honestly. Levothyroxine, sodium. I know sodium, that's salt. But levothyroxine, so the Synthroid is the brand name. Levothyroxine is to treat the thyroid, to treat thyroid hormone imbalances. And so you see in this image where the thyroid is. The thyroid is a lovely butterfly-shaped gland in your neck. That is what this medicine is treating, hypothyroidism. About 5 out of 100 people in the United States have issues with their thyroid. But you'll see here that the thyroid, again, is located in the neck. And this, we have seen this on the MBLEx. But see how the end of this thyroid treats the thyroid? So when you get a question on the MBLEx, it could be that you get this description. This is the drug that treats hypothyroidism in 5 out of 100 Americans, in people across the country. What is that drug? Levothyroxine. You still got the thigh, right? Right here, thyroid. And so this type of question is asking you to use your critical thinking, to pause, to dissect the question, to dissect a word. Thyroid. And that gives you a clue as to what condition it is treating. Moving along. Amoxicillin. Now, this is one you may have heard of. Have you ever had strep throat? You may have taken amoxicillin. Amoxicillin is one of the most common antibiotics in the penicillin. So you may have taken penicillin. And it's one of the most popularly prescribed antibiotics in this category. So amoxicillin is an antibiotic. Penicillin, it's in that penicillin class. It's one of the types of penicillin. So amoxicillin is used to treat bacterial infections. Now, if you have been awake over the last 3 years, you will know we have been dealing with COVID-19. COVID is a viral infection. It is not a bacterial infection. That's what made it so crazy, was that there were really no drugs to treat a viral infection. However, all too often, when people go to the doctor, they want something to take. I am sick, I need something to take. Well, amoxicillin and antibiotics are used for bacterial infections. If you do not have a bacterial infection, you do not need penicillin. If you have a viral infection, if you have a virus, antibiotics aren't going to help. However, because patients are so ingrained, because we are so ingrained in taking a pill, sometimes doctors feel pressure to prescribe. And penicillin, antibiotics, are one of the most common overprescribed medications. So amoxicillin is a powerful, penicillin is awesome. It's been used to cure a bunch of things. I mentioned strep throat, bacterial ear infections, bacterial pneumonia, respiratory infections. And that's the difference, right? Bacterial pneumonia, not viral pneumonia. So we need to pay attention, because this is what antibiotics are good for. And specifically, we're talking about amoxicillin. So it is a possibility. You might see this question on the MBLEx. 1 out of every 3 prescriptions is probably unnecessary for antibiotics. Can you believe that? Because antibiotics can actually really mess with your gut health. In fact, not only does it mess with your gut health, if a person is to take antibiotics too often, This can lead to antibiotic-resistant conditions. Here we're calling it antimicrobial resistant. But you may have even heard of this, that the bacteria that causes the sickness doesn't respond to antibiotics because your body has gotten used to taking them. That can be very dangerous. So a lot of awareness now. You may have already heard about this, but a lot of awareness now is being brought to this overprescription of antibiotics, and it's happening a lot less frequently. So that's the good news. If you have taken antibiotics and you have a little upset in your stomach, it's really a great idea to have to. Oh, it's just escaping my brain. To introduce yogurt, introduce culture into your gut. I will come back with that, and I'll put it in the comments. It's let's see. Anyhow, we'll come back to that. The actual word is leaving my brain, but the flora and fauna in your belly change, and by introducing yogurt, introducing kefir into your diet, it restores that flora and fauna, the good bacteria in your gut. That's what I'm trying to say. Moving along, let's take a look at non-steroidal anti-inflammatory drugs, NSAID, NSAIDs. And we're going to look at ibuprofen, which is the generic name of Motrin. So at some point in your life, you probably have reached for an aspirin, an ibuprofen. And this is a category of drug called non-steroidal anti-inflammatory drug, NSAID, NSAIDs. And it treats inflammation. So non-steroidal anti-inflammatory treats inflammation. So it helps to reduce pain, reduce inflammation, by reducing inflammation. It treats muscle pain, it treats headaches, it treats joint swelling. Some people take an aspirin to help reduce their risk of heart attack because it reduces inflammation. And it helps to prevent blood clotting. Ibuprofen has less of an effect. Aspirin is one kind of ibuprofen. Motrin, which is a different brand name, has less of effect on the blood cells or platelets, and it's not really used for this proper. So a baby aspirin is often used, taken once a day to help with blood clotting. Now, acetaminophen, that's Tylenol. That's a different category. This is not an anti-inflammatory. Acetaminophen is used, Tylenol is used for fever. It's used for pain, but it is not an anti-inflammatory. So that is the difference. We have Tylenol over here in this category, acetaminophen. Tylenol, there's other brand names, but Tylenol is the one we probably all know. And this is not an anti-inflammatory. And so it's used to treat fever. It is used to treat pain, but it does not address inflammation. Moving along, a new drug. Whew, I know. Lots of note-taking, right? Remember, you can always come back and watch this again. So we are going to be looking at Adderall. So the most common form of amphetamine or dextroamphetamine, Adderall. And you may have heard of amphetamine, right? That might sound familiar. So Adderall is the prescription that contains these two drugs, amphetamine and dextroamphetamine. We're not going to get at how it works in the chemical sense, but this is a medication called stimulants. Now, this Adderall is most often prescribed to treat ADHD, attention deficit hyperactivity disorder. Now, when I was growing up, let's say 30 years ago, this, was not a disorder. I totally honor people who have trouble focusing, who have hyperactivity, who have kids with hyperactivity. It's crazy, crazy. crazy to control. When I was growing up, it was called ants in your pants. So Adderall, ants in your pants. But this is a medication that can really help young adults, especially those in middle school and high school, to concentrate, to focus, to do better with their homework. I have family members who have taken Adderall, who have taken a stimulant to help with their focus. Most common type of medication is for ADHD, and in school-aged kids, it's Adderall. Do you remember the other one? I'll tell you in a minute. So, as I mentioned, the medication will decrease restlessness. It's also most effective when it's part of a comprehensive plan. This this medication treats the central nervous system. The restlessness also has a flip side. So we've talked about reciprocal muscle groups, right? Front and back. This drug also has a flip side. The child can be restless, but also this drug is also used for narcolepsy, which is sudden, like falling asleep, uncontrollable falling asleep. This drug can help regulate the central nervous system with both cases. The other drug the other prescription that is given for ADHD is sometimes Ritalin. That's another brand name, Ritalin. But the generic is amphetamine, dextroamphetamine, and it's being used to treat usually young adults with ADHD. All right, moving along. We have a few more. All right, Xanax. Okay, Xanax. A lot of your clients are going to be on Xanax. What is Xanax? So Al-pra-zoh-lamb, or Xanax. We hear that more often. This is a very, very popular medication to treat anxiety. It is needed to treat anxiety, but some people start to overuse it. Xanax is in a category of medication called benzodiazepines, just for short, benzo, but benzodiazepine. So if you speak a little Spanish, dia, every day, dia, D-I-A, means day in Spanish. So this is a drug people normally take every day. Xanax is not supposed to be long-term, but we have to be very careful as massage therapists about what we say as far as judgment. There are people who are on Xanax for a really long time. It is meant to treat anxiety for a short amount of time. But the nice thing about Xanax is it gives clients a euphoria. And so, again, some people tend to take it for longer maybe than they need. So benzodiazepine is the category. Benzo. I'll tell you about that in just a moment. Benzos treat anxiety, panic disorders. It can be used to treat epilepsy. But this, kind of social anxiety, sometimes for insomnia, but that's benzos. Xanax, it may say that people might tell you they're taking Xanax to help them sleep. Very much so, especially if they're anxious. Yeah. Let's just mention also that one of the challenges with clients who have been on Xanax for a while, when it's time to come off, when the doctor says, hey, not so much anymore, your clients can experience symptoms of withdrawal. And so it's much better for a client to slowly come off of Xanax than to go cold turkey. Just a little, piece of information for your treatment room, but also in case it comes up on the MBLEx. Not good to go cold turkey off of Xanax. You can have withdrawal symptoms. This is what Xanax looks like. Due to its calming effect, Sometimes people overuse it, but we have to be careful about judging. How people are using Xanax in the moment you meet them is just how they're using it. There are no shoulds. In fact, I would encourage you to eliminate the word should from your vocabulary. Take that in for a minute. Eliminate the word should. I would ask that you don't should on yourself and you don't should on others. Some of the symptoms of clients overusing Xanax, and you may see it on your treatment table, I certainly have. When a client is on the table and they fall asleep, if they fall deeply asleep, like when you tell them to turn over, they're not responding and you have to wake them, what type of medication are they on? If they're on Xanax, they may have taken one recently. So drowsiness, sleeping for long periods of time, vertigo, coming off the table, sometimes nausea, sometimes a headache, sometimes dry mouth, sometimes lightheadedness, but mostly what we see is this deep sleep. And so we just have to be prepared. We know that a session adaptation for someone taking Xanax is just to pay attention if they fall asleep hard. Now, that does not mean they're overusing Xanax. It could be, but it just means once they're on it, it's how their body is reacting to it. So they may still be in the process of regulating their dosage. And that's a fair question to ask. Are you in the process of regulating your dosage on your Xanax, or have you found that that sweet spot? That's a very fair question to ask and a very non-judgmental question to ask, right? We're inquiring because sometimes people will fall asleep hard. Okay, so our last medication that we're going to cover today is about Lipitor. Have you heard of Lipitor? I mean, anybody in your family? Anybody in your family say, I'm not drinking grapefruit juice? So Lipitor is a statin. And so let's take a look at this word. Atorvastatin. So you see the word statin in there? There's your hint. Normally we're tested again on the generic name, and it may be like, oh, what is that word? Pause, break it down. Do you recognize any of the parts of the word? If you just saw that word, it might be like, oh no, but look, statin. So Lipitor is a statin. And typically, if a client has high cholesterol, they are going to take a statin. Now, we saw a slide earlier that had to do with the side effects of statins. We'll come back to that in just a moment. But this drug works by modifying how much cholesterol the body makes in the liver. So it actually blocks the enzyme in the liver that's responsible for making cholesterol. Now, normally doctors will say, we're going to prescribe you this statin, and we need you to change your diet. I need you to start eating a more nutritious diet. Oh, and while you're at it, exercise. How likely is that? I know. Too often we're not willing to feel uncomfortable. We're not willing to shift even a tiny little bit. Have a green leafy vegetable once a day. Maybe take a vitamin. I know, it's not crazy. You're not going to become a health nut. But we become what we eat. What we put into our body shows up. And so doctors will prescribe Lipitor along with a healthy diet. Now, not everybody, not everybody is eating wrong. Not everybody eat wrong, right? I avoid the words right and wrong. Not everyone is eating an unhealthy diet. So sometimes kids ages 10 to 17 have a genealogy of high cholesterol. Their heredity, their mom and dad had high cholesterol, not for lifestyle choices, but just that's how their DNA is. Okay, pay attention here. Sometimes people just have high cholesterol in their DNA. Their liver produces more. That doesn't necessarily mean it's unhealthy. Doctors worry about it, and so they put people on a statin. But for your own practice, for your own experience, just know that sometimes the genealogy of that person lends towards high cholesterol. I've had super healthy people who still have high cholesterol. I have some in my family who have high cholesterol, but they eat super healthy and exercise. That doesn't necessarily mean they need to be on a statin. So lowering the triglycerides, the point of a statin is to lower the triglycerides with people with high triglyceride levels, which also helps to lower the chance of heart attack. And we see that associated with type 2 diabetes. Remember, there are two types of diabetes. Type 1, you're born with it. It's genetic. Type 2 is normally adult onset. Because of lifestyle choices, the blood sugar is not regulated. And so in people with type 2 diabetes, because of the food choices, they may be more at risk for a heart attack. I'm speaking very generically here, right? But I just want you to understand why statins show up. So the side effects of statins, headaches, hoarseness, low back pain, diarrhea, nausea, joint pain. Those are probably the three most popular, the three most common. As I mentioned, we had a slide out of order, but the three most common: nausea, dizziness, joint pain. That's according to the Mayo Clinic. Also, people have reported about headaches, about being hoarse, about low back or side pain, tenderness around the cheekbones, or a tenderness around the eyes. Some people have a little bit of a runny nose. There's a book that's been written also about the long-term effects of Lipitor and how it's the thief of memories. And so how statins in general are being shown to lead towards memory loss. Not good, right? Not good. So, so when a client is on Lipitor, what do they need to do? What do we need to be aware of on their behalf? We need to be aware of eating foods with high cholesterol. It can affect the efficacy of Lipitor, the effectiveness, the strength. So if we eat a ton of food with high cholesterol, it can affect or high in fat. It can change the effectiveness of the drug. Grapefruit juice has been shown to interact adversely with Lipitor. So no grapefruit juice for someone taking Lipitor. And of course, drinking alcohol while you're on strong prescription medication in general can increase the risk of liver damage. So, yay. All right, I think that's it. Oh, yay. All right, how you feeling? See this picture here? It's a picture of a graduate studying her medications, studying for the MBLEx, really. And have you found yourself like this with like tons of books open, like I was mentioning earlier? Oh, let me grab this book. Let me look that up. What is the origin of that muscle? What is the name of that medication? Sometimes you can feel like, oh my goodness, will I ever be able to remember everything? Yeah, there's a lot. And let me explain to you what's happening for you right now. You are building your knowledge. Many of you have a strong base of knowledge. You've finished massage school. We just reviewed 7 medications, right? That was enough. But what ends up happening is by building upon your foundation of knowledge, by doing meaningful homework, building your foundation of knowledge, there comes a point that I call the tipping point. The tipping point is when you're taking a quiz and you are like, wait a minute, I know the answer to that. A graduate just emailed me recently and said, oh my gosh, I just took the quiz. I think it was on upper body. And she said, oh my gosh, I knew the answers. I knew the answers. That feeling is the feeling of that tipping point starting to happen. That means you've built your knowledge, built your knowledge, built your knowledge. It's kind of like the roller coaster, right? Built your knowledge, built your knowledge, built your knowledge. Now you know. Woo! And that can happen with each topic. Oh, you know what we didn't cover today? The benzos. That's okay. We'll come back to that another time. I'll put it in the notes for you when I post this video. But that tipping point, woo! That tipping point, you start to feel more confident in certain categories. And a number of the graduates in this course have talked about feeling confident with ethics, feeling confident with their business knowledge. They feel confident in knowing best practices. And that's where we want to get to on each of these categories. Look, you graduated from massage school. You're going to graduate from this program. You graduated from massage school. You're going to graduate from this program too. And when you graduate from this program, you see past. How do you know when you graduated from this program? Pass. Pass. Jennifer yesterday sent me an email and said, oh my God, she handed me the paper folded. And I just started crying. I didn't think I had passed. She didn't open the paper until she got back to the car. And then she said she really started crying because she had passed. That's when you know you've graduated from this program and you're ready to launch into your career as a licensed massage therapist. I want you to just envision that for a moment. You've taken your test. You're looking at your paper. Pass. Yes. Yes. Let it out, man. Let that fire out. Some of it comes out in tears, right? But yes. I want you to be in that yes energy. You are doing the work necessary. If you are listening to my voice, you are doing the work necessary to pass this test. Bravo. You ready to dissect some questions? Oh yeah, we're not done yet. Yeah. Here we go. Your client is taking levothyroxine sodium, Synthroid. What condition may you want to ask about? Now, go ahead and feel free to put your answers in the chat. I'm going to take a peek. Oh, Frankie said, this was on the test yesterday. Oh, Mercedes, thank you. I'm going to mention that in a moment. Oh, look at you guys. All right, let me give you a shout out. Yuli, Frankie, Marina, Pumla, Kyra, Kiara, and Deborah. Ooh, and Nuyo. Y'all got it. All right. Y'all answered correctly already. Because you knew, right? You knew how to dissect the question. Let's move to the next slide because we're going to eliminate diabetes. We know Synthroid doesn't treat diabetes. Synthroid treats letter B, hypothyroidism. And thank you very much to Mercedes. She reminded me that it's a... Valerie got in there too. Good. That it is... Oh, I lost my head again. A culture, a prebiotic. Prebiotic, that sounds right. Anyhow, so I was talking about if you take an antibiotic. Anyhow, that's another category for another day. Let's move on to our next question. One of the most overprescribed drugs in America is amoxicillin. What is the category of this drug? One of the most overprescribed drugs in America is amoxicillin. What is the category of this drug? A, antibiotic. B, benzo. C, stimulant. D, depressant. What is the category of amoxicillin? Look at you guys. Frankie, Yuli, Marina, Nuyo, Kiara, Lana, you got in there on this one. Deborah, Valerie, yes. Valerie, yes. You got it, but let's eliminate one wrong answer because that's how we do this, right? So amoxicillin is not a depressant. Amoxicillin is, letter A, an antibiotic. Good job. All right, you answered that right, so it's going to get a little harder. Which of these is not an example of an NSAID? Which of these is not an example of an NSAID? Bonus, if you can jot down in the chat what NSAID, what the acronym NSAID represents. What do those letters mean? All right, let's get rid of one of our answers. Which of these, before we get rid of one of these answers, look at the question. This is how it just got harder. Which of these is not an example of NSAID? Watch your answer. Did you give me an NSAID? All right. Which of these is not an example? So when we go to the next answer, I'm eliminating an answer that is an NSAID. Aspirin is an NSAID. Yes. I'm looking at the chat. You guys are all getting it right. Frankie says anti-inflammatory. Yes, sir. Marina, Nuyo, Lana, Kiara, Yuli, Deborah. Yes, yes, and yes. What is not an NSAID in this list? Boom. Letter C, Tylenol. Tylenol treats pain. Tylenol treats fever, but it is not anti-inflammatory. Okay? Good. You answered that right. It's about to get harder. What is a caution for massage therapists if a client is taking Alprazolam? Alpra, Xanax. Hopefully we just see Xanax. A, overabsorption of the medication and the need for another dose more quickly. B, avoid the injection site. C, a tendency towards deep sleep. D, restless leg syndrome. What is a caution for massage therapists if a client is on Alprazolam? All right, let's eliminate one wrong answer. It's not injected. All the medication we've talked about is tablets, right? So it's not an injection site. Ooh, we've got a lot of answers here. Let's take a look at the chat. Yes, yes, yes. Holly chimed in for the first time. Good job, Holly. Yes. Pumla, yes. Marina, yes. Kiara, Deborah, Nuyo, Yuli, Lana, Frankie, yes, yes, yes. The correct answer is a tendency towards deep sleep. Remember, Xanax is taken as an anti-anxiety medication. It also sometimes helps with insomnia. Depending on the dosage, if the dosage isn't quite right, that deep sleep can occur even while getting a massage. So we do need to be cautious of that if someone is on Xanax. There's nothing wrong with it. That doesn't mean they're abusing it. Just means their dosage might be a little off. If they're having long periods of sleep. Hell, you don't know. They might just be tired on your table. We're not judging them. We leave our judgment at the door, right? I'm pointing to the door. We leave our judgment at the door. We're curious. We don't should on our clients. We don't should on ourselves. Before we move on to the next question, which is going to be a little harder, you got it right. Okay. Before we move on to that next question, I want to address A and B, because we did not talk about insulin today. Insulin. And so insulin, okay, here's a question for you. Ready? On your text? On your chat? What does insulin treat? If someone is on insulin, put it in the chat. Bonus points if you spell it right. I see some answers coming in. 10 seconds. Yep, answer in there. If it's safe for you to participate, don't be doing this while you're driving. 3 seconds, 2, 1, boom, let me check. Boom, yes. Yes. Yuli says blood sugar. I would accept that. Also, it treats the condition. Nuyo said diabetes. Deborah, diabetes. Yes. Insulin treats. Valerie said diabetes. Puma said diabetes. Holly knows what insulin treats. It's diabetes. Yuli, diabetes. Yes. Insulin is used to treat diabetes. And sometimes there's an injection site. So in the butt, in the belly, sometimes there is a pump, an insulin pump, depending on their condition, type 1, type 2. But if there is an injection site during massage, we simply avoid the injection site. That would be considered a local contraindication. If your client has a pump, we just avoid the area. Something about diabetes, though. One of the benefits of massage is it increases absorption. So we've talked about the digestive tract in the past. We've talked about the benefits of massage, increasing absorption. It helps with digestion. It helps the food to absorb more quickly. It improves our bodily functions, right? So when a client has blood sugar issues, high or low, high is diabetes, we do need to be aware if they're on insulin, because the massage may help them absorb their medication more quickly. Okay? So they may absorb their medication more quickly, which means they can feel lightheaded. They may have low blood sugar. So if they're controlling their blood sugar with their meds, they get a massage and it absorbs more quickly, their blood sugar could go down. And so they may feel, so it's a great idea just to have crackers, a little orange juice, a little, maybe even some type of juice. Don't do grapefruit juice, just in case they're on another medication, right? But a little something sweet in your office, or something just to put some food in their stomach, because if massage improves the absorption, then it is less in their system. Does that make sense? It goes through their system more quickly. Yeah. So just wanted to speak to that. So that doesn't have to do with Xanax. Could have to do with Xanax too. The absorption rate goes up of all medications. And so they may need to take their next dose early. I hope that makes sense, but I wanted to speak to that. All right. I think we have 2 more questions. What are some of the common side effects of Atorvastatin? Atorvastatin, Lipitor. Atorvastatin, Lipitor. What are some of the common side effects? A, headache. B, lower back pain or side pain. C, diarrhea, upset stomach, muscle, and joint pain. D, all of the above. What are some of the common side effects of Lipitor? I am seeing Frankie, Nuyo, Pumla, yes. Deborah, Marina, yes. Kiara, yes. Valerie, yes. I didn't even give you eliminate the answer on this one. We went right to boom, D, all of the above. Look, it kind of sucks to be on a statin. I'm just saying. I mean, when they first go on it, man, I remember I've had colleagues, I've had clients, I've had family members. They don't feel good. If they can get off the statin, that would be good. So diet and exercise, statin. I mean, doctors, if you're a doctor out there, I appreciate the benefits of statins. I really do. But I also know how it makes a person feel. And all of these are symptoms. Headache, low back pain, diarrhea, upset stomach, muscle and joint pain. People are just not feeling good. Great, they've got low cholesterol. Okay, they're not going to die of a heart attack. They're not going to have a blocked artery. If you are becoming a licensed massage therapist, let's look at the natural and the pharmaceutical way to help. How about that? All right, last question. Your 16-year-old client is a high school athlete. His mom has asked you if you will massage him during the baseball season to help him with his recovery. You agree. You notice he is on the medication amphetamine, dextroamphetamine. What are some precautions that you will take when you work with this student? A, minor release form and watch for restlessness and or deep sleep. B, minor release form and avoid the injection site. D, minor release form and parent must be present for all sessions. D, health information release form to allow you to let his doctor know he's getting massage therapy. Read it. I see some answers coming in. You're very quick. Oh, we've got some controversy going now. Okay, let's dissect the question because I see all sorts of different answers coming in. Your client is a 16-year-old high school athlete. What do we take from that? This client is a minor. Yes. 16 years old. His mom has asked if you will massage him during the baseball season to help with his recovery. So he's a good athlete. You agree. You notice he's on medicine. So now you've seen a health intake sheet. He's on the medication of amphetamine, dextroamphetamine, Adderall. You are the massage therapist. What are some precautions you will take when you work with this student? A, minor release form and watch for restlessness or deep sleep. Okay. B, minor release form and avoid the injection site. C, minor release form and parent must be present for all sessions. D, health information release form to allow his doctor to know that he's getting massage therapy. Okay, let's pause here. Do we have to let his doctor know that he's getting massage therapy? Has anyone talked about that? We actually aren't being asked to let his doctor know. We may need to let his doctor know, but that's not a part of this conversation. So let's eliminate that as an answer. Now, if we let his doctor know, then we would need a health information release form. But that's not a part of this conversation. We are contained right now. So let's eliminate that as an answer. The other thing is we always, always, always need a minor release form. So A, B, and C say minor release form. 16 years old, we always, always, always need a minor release form. Always. MBLEx, always. Okay? Anybody advise? I'm going to take a look at the last few. Okay, so the 3 we have left is all minor release form. As the massage therapist, what are you going to be watching for? Watch for restlessness and or deep sleep. Avoid the injection site. And a parent must be present for all sessions. Let me see the answers. Okay, so let's see. We got some feedback here from Frankie. Said it isn't B. You are correct. It isn't B. There's no injection site for Adderall. So basically, Deborah, y'all are saying it's either A or C. What is the best answer? Frankie says A. What's the best answer? This is how we get to the best answer, guys, gals. Ready? A. Yes. The minor release form, watch for restlessness and or deep sleep. You now know that Adderall can cause both. Yeah. Why isn't it C? Tell me in the chat. I will tell you in the recording, but I want you to tell me in the chat. Why is it not C? Okay, it asked about precautions. Yeah, precautions you would take, sure. But there's a key word in the answer in letter C that makes it not correct. What's that key word? I will read you the statement in case you can't see it. Minor release form, and the letter C says minor release form, and a parent must be present for all sessions. Yuli, tell me more about parent must be present. But you're on it. There is a standard of practice, and you will need to know your standards of practice for your MBLEx, that with a minor, we need a minor release form. Oh, I like it. Yes, same-sex parent. The mother with a son is actually, it's okay. Just she would exit the room as he's dressing and undressing. But here's the key, you guys. Minor release form, and a parent must be present for all sessions. That is not our standard of practice. Parent does not have to be present for all sessions. They have to be present for the first session. Tricky, tricky. Yep, tricky, tricky. Typically, we want a same-sex parent. Definitely for females. It's also best practices if it's a same-sex therapist, but that's not always going to fly. Standards of practice. These are what our standards of practice are. They're not laws. The minor release form is a law. But these are our standards of practice. Yeah. And the parents have to consent. Yes, exactly. Yes. So the parent has to say, and the client, the baseball student, the 16-year-old, have to say, I'm comfortable. And the parent has to say, I'm comfortable, and they've signed that minor release form. Yeah. Yeah, it's actually, yeah. So Valerie says she was taught all sessions. That's the best practice. But a parent isn't necessarily going to be available for all. So our standard of practice is at least the first. And I would strongly recommend that that's the protocol you use. Look, I even do this with husbands and wives. Now we're getting off on a different tangent, and you can ask me about that if you want. But certainly with minors, minors as a 16-year-old. That parent has to be present for at least the first session, and it's best practices if they're there for every session. But then we are encouraging this kind of helicopter parenting. So if use your intuition, in your own practice, use your best discretion in your own practice. Guess what, ladies and gents? That was the last question. Oh, it wasn't the last question. Oh, whoops, I thought it was the last question. Sorry. Okay. When reviewing your client's health intake sheet, you notice she's taking Lisinopril. What condition is most likely the reason she's on this medication? Lisinopril. Okay, this is using one of those helpful hints that I gave you, or those strategies I gave you earlier. Man, Frankie must have just taken the MBLEx. He's on top of this. Valerie, yes. Pumla, yes. Let's eliminate one wrong answer, because that's what we do. It's not a blood thinner. Lisinopril is not a blood thinner. Not how it works. See a few more answers coming in. Excellent. Yes, Yuli. Yes, Marina. Our best answer is, boom, an ACE inhibitor treating high blood pressure. That's correct. Remember Pril, famous Phil, holding an ACE? Yeah. Pril, Lisinopril, holding, famous Phil, holding an ACE? Yes, it's an ACE inhibitor treating hypertension, high blood pressure. Okay, now we're done. Yay! Thank you so much. Oh my goodness. Nice work. Bravo. Bravo. You just spent the last hour preparing for the MBLEx. Yes, you did. Yes, you did. Good job. And you did a great job. I'll bet you there was at least some of this information that was a little bit new. So that's the point. So I'm going to wrap up this part. I'm going to wrap up our session online in the recorded video by saying thank you so much for taking the time to be here. My name is Jodi Scholes. I am your instructor for the MBLEx review course. For those of you who are live with me in class, I'm going to hang out for another 10-15 minutes, answer any questions that you may have about this material or about the MBLEx in general. But for those of you watching later, thanks again. Really appreciate you being here. And I so appreciate you wanting to be, envisioning yourself to be a licensed massage therapist. You are my people. And I'll see you again real soon.